Good morning, and thank you for joining us today. My name is Beth Potter, and I'm the President and CEO of the Tourism Industry Association of Canada and the co-chair of the Canadian Travel and Tourism Roundtable. The travel and tourism industry is a vast and important one here for Canada, and the health and safety of Canadians has always been our first priority. The sector has worked tirelessly over the course of the pandemic to put in place robust, industry-wide protocols for a health and safety end-to-end travel experience from start to finish. Further, our sector has worked hand in hand with government to ensure the safety of Canadians and those traveling to Canada. In 2020, we understood that immediate and drastic action was needed to protect the health of all Canadians. This included lockdowns, capacity limits, strict border limits, and other measures. And our industry met these calls. In 2021, when the government announced that all federally regulated industries and everyone 12 or older on a plane or a train had to be fully vaccinated, we answered the call. This sector remains one of the safest internationally. And we want to reiterate our strong support for any government decision to increase vaccination rates. Today, Canada's vaccination rates are among the best in the world, with very low hospitalization numbers and a population that is anxious to return to more normal lives. Everyone understands that getting back to normal will be a long and challenging road. But Canadians tell us they are eager to travel, and Canadian tourism businesses are ready to welcome the world back to Canada. In anything, it's easier to switch something off than it is to turn it back on. But right now, we need to be focused on creating an environment where we set ourselves and our country up for success. Today, I am joined by Dr. Zain Chagla, infectious disease physician and associate professor at McMaster University, and Dr. Dominic Mertz, division director, infectious diseases at McMaster University. And I'd like to now invite Dr. Mertz to say a few words.
Good morning, everyone, and thanks for coming out here. When I was asked to speak to the topic of travel restrictions and PCR testing for international travelers in particular, I thought probably best to take a step back and ask ourselves, what's the rationale, what's the justification for any type of travel restrictions with a focus on PCR testing? I came up with 5 reasons why, and I will comment on as to why this may or may no longer make sense. The first is travel restrictions are justified when you're facing an unknown pathogen, an unknown virus, and that's the situation where we had been 2 years ago, where we tried to keep this virus away and tried to isolate it in China, which turned out to be futile, unfortunately. We've known this virus now for more than 2 years. It's probably the best studied virus out there, with still roughly 2,000 publications on SARS-CoV-2 every single week. We do know how to reduce risk. We mask, we keep our distance, we try to gather outdoors whenever we can. And we have another tool in our toolbox. We have vaccines, and those hold up very well against Omicron as well when we think about preventing severe disease. And when we are talking about international travelers, we are talking about a double, often triple vaccinated population. A second rationale would be to prevent COVID from either coming here or from becoming endemic eventually in Canada. And important to remind people that travel restriction in its core are a COVID-0 strategy, where you try to actually have optimally zero community transmission. And every case that comes in from abroad may put additional measures, lockdown measures, onto you. But Canada has not, and realistically will not, eliminate COVID-19. And Canada, as well as the rest of the globe, pretty much will transition step by step into endemicity, and travel restrictions and testing at the border is not going to prevent COVID from staying here in Canada. You can argue then, and that's my third point, if you're not able to eliminate, still you may be able to reduce the influx of positive cases and as such still reduce your community transmission eventually. When you think about that, it's important to note that less than 1% of our cases across Canada had been associated with international travel, so a very, very small proportion. Of course, this would have been higher if there were no restrictions, if there were no added travel inconveniences such as testing. But again, when you're looking at what's happening around us with community transmission, it's extremely unlikely that the travelers that come in potentially positive will have any sizable effect on transmission. And when we think about the value of testing to prevent this from happening, we did a study here at Toronto Pearson's in fall 2020, so in the pre-vaccine era, where we enrolled more than 16,000 international travelers here. We tested them upon arrival, and they tested themselves on day 7 and 14 when they were isolated somewhere. And what we found with the arrival testing was that roughly 160 people were testing positive. So roughly 1% of those more than 16,000 that we would have tested. When we were looking at the CT values, which give us an idea of, was this likely an active infection? Was the person infectious or not? I would say for roughly 1/4, so maybe 40 to 50 of those more than 16,000 were probably infectious at this point of time. So a relatively low yield testing. And we also found that, as you would expect, that if you traveled in from a higher epi region, that the risk for testing positive is higher than in someone who's coming, for example, from New Zealand. And that suggests that, yeah, there is a gradient, but as long as the risk for the average traveler coming in is in the same ballpark as if you were testing a random person in downtown Toronto, it's not going to make a difference. And the same theme around that gradient would apply to domestic travel as well, right? We can travel hundreds, thousands of kilometers within Canada from a higher to a lower community transmission setting by car, by airplane, by train, by bus, with no testing whatsoever. One argument that's been brought forward, particularly for the pre-travel testing, is to prevent transmissions on aircrafts. And I have to quote here because there's actually a website from the Government of Canada that's summarizing the evidence around transmission on airplanes. And I quote from the website, they state, while it is true that air travel can result in the importation of passengers with COVID-19, that's out of question, that's also what we found in our study. They state that the risk of spread of COVID-19 amongst passengers while traveling aboard aircraft appears to be low. And they also quote the European CDC, which states the risk of being infected on an airplane cannot be excluded, but is currently considered to be low for any individual traveler. And I think we all know the reason for that. Airplanes are probably the best ventilated indoor setting that you can gather with other people in, and any respiratory pathogen has a hard life to transmit from one person to the other. This sort of reminds us of a policy inconsistency that we have. We do allow indoor gatherings in higher risk settings with documented superspreader events, which we don't have on airplanes. Thinking about bars, restaurants, gyms, or your social gatherings in your own homes. And we don't need any testing whatsoever, but we do require testing for international travel and for airplanes. The last point, my fifth point, I will only touch very briefly on because my colleague Dr. Chagla will go into a little bit more depth. But one other rationale is to prevent those variants of concerns from coming in, any potential new variants of concerns, and to contribute to the international VOC surveillance. Now, needless to say that any single VOC made it in here, despite different levels of travel restrictions, testing strategies, isolations that we had. And there are smarter ways to do surveillance than testing and isolating random international travelers. With this, I'm handing over to Dr. Chagla. Thank you very much.
Hi, everyone. Good morning. Thanks, Dr. Mertz. I'll pick up a little bit in those points and really go again and with my own 5 reasons why I think, the travel testing in particular and the way we deal with travel does need to change. Firstly, I think we have to recognize what happened in the last 2 months in Ontario and Canada. We have done an incredible job over the last 2 years to reduce the risk in the population, to keep things at bay. Omicron changed things quite a bit. A lot of people were infected. A lot of people were infected despite of their vaccine status. There are credible estimates from the Ontario Science Table suggesting 1.5 to 4 million Ontarians were infected over the last 2 months. And so when you think of the context here and in the frame that Dr. Mertz had in terms of trying to prevent Omicron from coming into Canada, when 10 to 30% of your local population already got COVID-19 over the last 2 months, it really, becomes a little bit futile to try to prevent it coming over the border, recognizing there's going to be a risk with traveling, but there's going to be an equal risk the second you leave this airport and you go into your own homes, into a high-risk setting, for seeing COVID-19 in those settings. And the same barriers that we use, physical distancing, masking, ventilation, are appropriate and should be used with travel as well as should be used domestically. But recognizing that travel risks are evening out to the risks of getting COVID locally, and the control of COVID locally is not as optimal as it should be. Recognizing Omicron is a very, very highly contagious variant, really does have to be framed in this travel argument. Number 2, the test we're using is out of date. Molecular testing or PCR testing is extremely sensitive for COVID-19. Tests are expensive. These run to $100 to $200 a test, even more in some settings. Travelers who are abroad are faced with hundreds to thousands of dollars to pay for their families to get tested to return to Canada. They're at the expense of countries that can charge whatever rates they need so that, again, people meet the travel requirement to enter Canada. They have to meet the turnaround time for under 72 hours, which adds an additional expense. If people aren't able to find appropriate testing, they have to go to agencies that can provide that, which often are more expensive. They have to test every member of their family, despite their vaccine status or not. Similarly, there are from media reports, what's happening at the airports for border testing is upwards of $600 million that's publicly funded. And so, again, there is something to be said about the costs here, both for the individuals, but actually for the public, for testing that may not reveal exactly what we want to reveal and may not be preventing a lot of people from spreading COVID-19 locally. A third point with this testing, and really hammering this type of test is extremely sensitive, and it really, at this point in the pandemic, may introduce harm to travelers. We talk about that 10 to 30% of people in Ontario, and likely the same number across the country, that got COVID-19 recently. But what does that mean? Well, when they go get a test, they'll be positive, as they would in this setting. Many Canadians can't access testing right now. The public health restrictions on testing are focusing on people that are vulnerable, healthcare workers, essential workers, where, again, the utility of testing really does lead to more positive outcomes. The average individual can't access a test if they're symptomatic. And so when that person in the last 2 months develops COVID-19, isn't able to access a test, does their due diligence and isolates for the required time, goes out and travels a couple months later, we know tests can stay positive for up to 6 months for individuals. So when they're testing in their foreign location, they may test positive, but they may not be infectious to others. It may be from this COVID-19 in the last 2 months that they acquired. But what does that happen? What happens to that traveler? They're now isolated in that setting. They have to find alternative accommodation if their accommodation can't accommodate someone that has COVID-19. They have to, delay flights and go through the expense. They have to deal with local issues with COVID-19 control, which could be just isolating in a medical facility. isolating potentially in a country that may not be the safest place to isolate. And all for what? They may not be infectious to others. This may just reflect the fact that they had COVID-19 and weren't able to get tested on Canadian soil and are now being faced with restrictions to coming back to Canada because of the fact that they couldn't get a test in Canada when they were symptomatic. And the same thing may happen when they come over the border. They may test positive, they may have to go into isolation and be called a case related to travel, when in reality, again, they may have had COVID-19 a while ago. And this isn't theoretical. Myself and Dr. Mertz work in a hospital. We do testing in many settings of asymptomatic individuals, particularly preoperative or people coming to the emergency room with other issues. And we find a lot of these cases. It's actually getting much worse now. It's causing clinical care to be disrupted. And so I can imagine at the level of travel where the experience and the wherewithal to kind of resolve people and figure out if they're old or new is not as easy. It's going to lead to a lot of disruptions of travelers that, again, did the right thing and essentially could not get tested and have a molecular test documented before they return. Fourthly, I do want to point out the inconsistencies in quarantine practice amongst individuals coming back to Canada, and particularly amongst children who face a longer period of quarantine, despite the fact that, again, the requirements for quarantine after travel are actually in excess of the requirements for quarantine and isolation for children if they're exposed to COVID-19 or even acquire COVID-19 in their local communities. So, for example, a school-aged child in Ontario who comes in over the border, who comes in through one of these doors, is now isolated for 14 days from school or childcare. But if they were to acquire COVID-19 in Ontario or be exposed to COVID-19 in Ontario, they would be excluded for 5 days. And so, again, this inconsistency does, deal on the face of travelers, particularly parents. Some of their travel is essential to funerals or to see family or to deal with life events. And those children who, again, have been out of school for some time, who, largely are asymptomatic, are unfortunately excluded from activities that are essential for them, again, where in their local communities, if they were exposed to COVID-19, would not face the same amount of restriction. Finally, I think one of the arguments for testing over the border has been a surveillance network for variants of concern coming in. We obviously know every variant of concern, Alpha, Beta, Gamma, Delta, and Omicron now are in Canada. The border measures, may have slowed their rise, but certainly they propagated in Canada. Omicron is now the dominant variant across the world, including countries like Japan and Israel who imported very strict restrictions on travel. It's highly contagious and it will come over the border. And so, there are better ways to be looking for variants of concern in our communities. We are now investing more into wastewater testing. And again, that is a technology that we can be using for community transmission. It can be used for sequencing or for looks for variants of concern as they're appearing in the population. And certainly there were indications of Omicron in the wastewater in Canada before the alarm from South Africa that this variant was emerging there. There's a need for better sequencing, and that federal investment into sequencing technology that could be used from this type of testing could make sure that people in local communities who get tests then have sequencing that's done to really do that surveillance in our communities to see what's happening. And finally, you could certainly prioritize and invest in local communities so that travelers who do become symptomatic after their travel have access to a test. Again, it's inconsistent that someone who's asymptomatic at the border has a PCR test, but when they go back into their community and a day or two after their travel, develop symptoms, don't have access to a test, where that person is probably the highest yield person to do surveillance for variants for, is not there, right? And so again, there are ways to use our local communities to make sure that we do have surveillance for variants of concern, recognizing that we won't be able to stop them, but again, a smart way of reprioritizing that technology may be able to detect what's happening locally and not necessarily impede travelers coming in. So with all those points, I hope we do reconsider this, and I guess I'll turn it over to the crowd for questions. Or back to you. Mm-hmm.
Thank you, Dr. Mertz and Dr. Chagra. We are now open to questions.
Perfect. Thank you, Beth. We'll start with questions here in the room, and then we'll go to the operator.
Hi, Beth. Jamie Goodfroy from CP24. I'm curious, when you What kind of conversations have you been having with the federal government when you raise these issues, when you bring scientists to the table and say, listen, a lot of these current rules and measures, they're non-science based, and you can even argue nonsensical. What's been the reaction from the government, and are you getting a sense that they are willing to budge at all, in moving forward?
So thank you for the question. And the conversations we're having with government, both at the ministerial level and down through the official ranks, they continue to remain very focused on the safety message as well as the protecting the healthcare system. And so we are now, by virtue of today, trying to bring some clarity to that, to make sure that the government understands that this industry has been putting the safety of Canadians at the forefront, and we're bringing the data that supports our requests to government as well.
Do you know how much right now we're spending on Switch Health to administer this program, to conduct these PCR tests, not only on site, but for those travelers who arrive from an international destination? They have to take home a kit, they have to go online, have a face-to-face meeting with a nurse, and then after that is done, you got to put your sample in a bag for a Purelator or an Uber to come pick that up. And there are cases, and I know this from experience, where they're not even coming to pick up the sample. And then you have people who are expected to stay at home for 5 to 2 weeks in a quarantine period, even though they might be double, triple vaccinated, they've been boosted, maybe they took a PCR test when they got home. I mean, do we know how much we're spending on this company? And, furthermore to Dr. Chagla's point, we can't even get tests for people who are symptomatic here, and you think those tests would be better used in other areas where we need it? I know it's a long question.
Yeah, that's okay. We can unpack this a little bit. But as far as what we're spending as a country on these testing standards, I don't have that information at the top of off on me right now. But we can see if we can't source that for you. But you're right. There's some inconsistencies in the application. Dr. Chagla, do you have anything that you can add?
I mean, sorry. Yeah. I can't imagine this is cheap, right? The cost to run a molecular test is $150 to $200. The cost of a health professional is, quite a bit of money. If you're doing this repeatedly over and over again in the day, we're talking thousands of tests. I think you can get a sense. You're probably talking into the millions range in terms of this. Again, there were media reports of all the contracts being over $600 million. I can't validate that, but certainly there's a huge expense here, and again, for the inconsistency of people not being able to be symptomatically tested locally for things like schools and other high-risk venues, it does really, point to the fact that maybe we should be talking about reducing this expense and putting it back into our communities where it's needed.
Well, you raised a good point, the fact that someone who is living here right now who gets infected with COVID-19 will have a 5-day quarantine period, but if you're landing here from an international destination, you test negative to get on the flight, and then you have to wait to get those results. And now some people are waiting a week, it could be waiting 2 weeks for that results, and at the same time the government is providing pamphlets that is offering some fairly intimidating language that says, if you don't stay at home, we might send a border service agent to your place, and we might send you to a detention facility. And I'm wondering, from the science aspect, it seems nonsensical.
Yeah, no, exactly.
And from a civil rights perspective, I mean, for a lot of newcomers to Canada, that's got to be pretty scary.
Yeah, absolutely. And again, what are we trying to achieve here? If someone's in their local community, can't have access to a test, they're expected to isolate for 5 days in Ontario. If you imagine you're waiting for your test for a week from the border, you've already passed that 5 days. Even if you were COVID-19 infectious, the worst, the most infectious at the airport, you've already passed that period of quarantine by the time you have your test result back. So you're not even a threat to anyone anymore in that sense. So again, there is a lot of this alignment that really does need to be replaced. Many provinces are talking about shortening isolation period. They have shortened their isolation period. Places like BC have just said, stay home till you're feeling better as the standard. And so, again, there is a big need here to really be rational here and align to what the expectations are for people within the province. And again, not be punitive about it in that sense. There's better ways to be and better resources for these services to be deployed to.
Hi there, Sean Leadong with CTV News. Just want to clarify, are you calling for all testing requirements to be lifted?
I think at the bare minimum, stopping PCR testing. We're the only G7 nation that requires PCR testing as part of their entry. Some jurisdictions are still using rapid tests. Certainly in some populations that might be considered. But again, we have to really fundamentally think about what the point of testing is for travelers. We may be able to go to a Raptors game in the next couple of weeks, and certainly we went before the Omicron wave. There's no requirement to be testing, going into a stadium full of 10 to 20,000 individuals for 4 to 6 hours as part of that. So why do we impose, a test for someone that wants to fly to New York, where they're in a well-ventilated space wearing a mask, often vaccinated as part of the requirements, where a 10,000 to 20,000 person activity doesn't require a test. I don't know if you have any more comments, Dominic. No.
Also, I wanted to ask, does this all hinge on proof of vaccination, or is it something that could cover anyone?
Yeah. Dominic, do you want to? I feel.
So I think at this point of time, we are really talking about what we consider fully vaxxed population, so double vaxxed, many would be triple vaxxed, as I mentioned. And that's not unusual when you think about travel, right? Part of travel advice would be make sure that you have the vaccines you require for the destination you go to. And I think it's a valid point you can make to say, we want the Canadians to be fully vaccinated when they go abroad to prevent them from require hospital admission because of severe disease, and you can require the same vice versa. So I would say it's in keeping with other vaccine, sometimes mandates or recommendations that we have for international travel.
Also, what kind of timeline are you guys looking for here? Is this the type of thing you'd like to see immediately? Because in a few weeks in Ontario, things are going to start opening up here. So basically, what kind of timeline would you like to see?
I think all the arguments we brought forward are as valid now as they are in a few weeks. So why to wait?
And would this dropping of all PCR tests apply for international travelers as well as Canadian citizens as well? Because I know currently there's still the surveillance for international travelers. Is that what you were calling for?
Yeah, I mean, I think, obviously there is a huge amount of Omicron that's circulating in other places in the world. And so other travelers, people who are coming to Canada to see their families, people that are not Canadians that are coming in, similarly, they're going to be stuck with the same PCR issue as they come to Canada. And it's going to really disenfranchise them from coming to Canada, recognizing that there is a huge amount of disease that's occurred in the world, that there are credible estimates from the Institute of Clinical Metrics suggesting 50% of the global population will get COVID by the end of March. And so, again, that means a lot of those tests are going to be very difficult to interpret of international travelers. And again, they're not necessarily, as Dr. Mertz's data has shown, they're not necessarily a threat to Canada, recognizing that, we aren't able to test locally in that sense. And again, a lot of this is just residual disease that's showing up on molecular tests.
Question for Beth. I know Canadian Travel and Tourism, this is a coalition of people within the travel and tourism and industry, and it has a huge effect, given the fact that this is a $102 billion sector that accounts for about 2.1 of the country's GDP, but there's that trickle effect and when it comes to the economics, because if we're having people quarantine when they arrive here, they're not able to go to their work. Productivity starts to continue to suffer. And I can only imagine how many other sectors and other industries are affected by these PCR tests, these requirements. And I'm curious, are you having any other conversations with other external bodies or organizations that are, still feeling the economic effect of these measures? And I'm wondering, they say that there's strength in numbers. Are you looking to maybe get more organizations on board to really put the heat on the federal government, saying, listen, these measures they're outdated?
So thanks for that. I will say that I chair two coalitions, and I'm a part of a third. And via those coalitions, there are many businesses and many industry segments that are represented. And to your question earlier about when do we want to see this lifted? One of the important things to remember is that when people are thinking about vacation, so leisure travel, and they're thinking about things like March break or this summer, the upcoming summer, they're booking now. And so now they're looking at what hoops do I have to go through in order to travel to Canada, and they're making a decision based on what's available to them, what the process looks like now. So it's and then there's the business travel. Business travel is a huge component of our industry. If you look at business travel nationally, it is equal to what Ontario does in travel and tourism every year. And so we need to get business travelers back. And with the testing requirements the way they are right now and the uncertainty around how long they may have to isolate on arrival, there are an awful lot of companies that are saying no to business travel.
How long do you think this is sustainable for this current way that we're doing things here before we start to see some serious impacts on the Canadian travel and tourism sector, the loss of staff, the loss of revenue? How long do you think this can last for before we start to see some serious impacts on your industry?
We're already seeing serious impacts on our industry. Our industry is half of what it was in 2019. And the forecasting that I'm looking at is we don't get back to where we were in 2019 until the end of 2026 at this point in time. So it's going to take a long time for us to rebuild, not just rebuilding confidence in Canada as a destination, but rebuilding our workforce. Our workforce has taken an absolute hit because we're seen now as a very unstable industry in which to harness your career.
Thank you. With that, we'll go to the operator. Operator, any questions?
A reminder to press star 1 if you want to ask a question over the phone. Next is Momin Qureshi at City News 680.
Hello, good morning. Thanks for taking my question. I just want some clarification. Are you still okay or asking for non-vaccinated travelers to have to get PCR tests?
Yes, that's correct.
Okay. And my second question is, I just wanted to know if are you guys looking to places in Europe like the UK and Denmark and other countries that have backed off those types of restrictions and using that as part of your pitch or your argument to the federal government to lay off these types of restrictions?
Absolutely. We're looking at all the countries as they come out with changes to their requirements for travel. UK, Denmark, Sweden just this week, Switzerland last week, and we're taking all of those examples to government.
Great. Thank you so much.
Thank you.
No other questions on the phone.
Great. That concludes the conference. Thank you very much.
Thank you very much.